Hi, welcome to Making a Monday, a weekly workshop for mums and dads in the making. Making a Monday is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic that focuses on IVF support, pregnancy care, and also fertility. Today we have a special guest, Rhiannon. Hi, Rhiannon.
Hi, Amy.
And Rhiannon today, she is going to be talking to us all about sperm health, and in particular, all about sperm health, and what are the markers to indicate that the sperm is really healthy, right, and really fertile. And she's going to talk to us a little bit about COVID, because COVID really impacts sperm health and the things that you can do tangibly to improve sperm health in the context of COVID, but also just in general. So it's a really exciting session, and I am getting super excited. And for those of you who don't know me, my name's Amy Forth. I'm the director of the Acupuncture Pregnancy Clinic, and these Making It on Mondays are weekly workshops for mums and dads in the making, and they're all about kind of empowering people on their path to parenthood by providing these educational weekly workshops on loads of different topics. So we talk about nutrition, we talk about mindset, and we also talk about traditional Chinese medicine, of course. And we love to include experts from both inside our clinic and outside of our clinic. So today we're having a very special guest, Rhiannon Hardingham, who is an expert nutritionist and naturopath. Rhiannon's been in practice for about over 15 years. Not only is she a clinical naturopath and nutritionist, a practitioner, but she's also an educator. She's an author. And Rhiannon specializes in male fertility as well as female fertility, IVF support, and also pregnancy care. She's really known for expertly caring for couples to help them overcome their fertility challenges. And male fertility is a really significant part of her practice. She really especially focuses on this as well. So she today is going to bring us some up-to-date evidence and the best guidelines around male fertility, sperm health, and also in the context of COVID in terms of how to prevent acute management of COVID, and also around post-viral. So I would really like to welcome Rhiannon. Hi, Rhiannon.
Hi, thanks so much for that lovely introduction.
You're very welcome and deserving.
Thank you.
So I guess the $1 million question is really, so many patients come into our clinic and they say to us, oh, I think the sperm's all fine, or I'm not sure, I think it was okay. I think a lot of patients out there aren't really clear about what are the key kind of markers that the sperm, that sperm is healthy and really fertile, has a really good fertility potential. So I'd love it if you can share with us a little bit about what we should be looking for in terms of a semen analysis.
Yeah, absolutely. And I think it's probably also worth saying, and this is top of mind for me because I've just been this morning, in fact, going through the recent research on this, because I'm just putting together my masterclass that I run for practitioners on this particular subject. But I've just been looking at the recent research, and it just confirms what we have known all along, that male factor infertility or fertility, a compromise in male factor fertility, significantly influences IVF outcomes, including ICSI, and it isn't enough of an answer or an intervention just to do ICSI when there's male factor issues. It is the medical indication and intervention, but there's so much that can be done for the individual to help to improve their semen health that then goes on to improve their IVF outcomes. So I think the key thing to understand about semen analysis itself, and this is a really broadly misunderstood factor, that the reference ranges on the semen analysis results were put together in 2010 by the WHO, but they were never intended to reflect what is healthy and what is normal. They took this data from a very, very large study of fertile couples. They took the figure that was the fifth percentile. So 95% of the couples that conceived in the 12 months prior to this date had sperm better than the results that are printed on the semen
Wow.
analysis.
So actually 95% of them.
95% of them had
was
better
than what was
quality
on those.
sperm.
Yeah.
This reference range is intended to be the lowest tolerable level in which natural conception may occur. And below this threshold is a strong indication for IVF referral. So, for example, the reference range for sperm count is 15 million. Anything less than that means it's extremely unlikely that you'll conceive naturally. But we know from broader research that actually males require a sperm count of about 40 or 50 million to not have delayed time to conception or reduced fertility. So those reference ranges are not the average. It's not normal. It's certainly not good. It's the absolute lowest tolerable limit before IVF with ICSI is indicated for male factor fertility.
Yeah. And we won't go into it anymore, but the reference ranges have changed significantly over time as well.
Yes.
Not only do they just reflect what you've talked about, just being that like lower percentile, but that has shifted enormously down over the last 50 years.
Yes.
Anyway,
in that time, we've been working.
Yeah. So in terms of count, you think around kind of 40, 50 mil is really where you ideally want to be, like
exactly.
Yeah.
Really, you want to have a minimum of 40 million to achieve natural conception, and probably as a reflection of sperm quality, that would be ideal for IVF. Of course, the sperm count doesn't matter so much with IVF because they are just because they only need a smaller amount of sperm. So the quality is more important than the number with IVF, natural conception. But it's still a reflection, obviously, of testicular function and likely sperm quality.
Sure. Yeah. And what about in terms of morphology, like in terms of how many normal forms there are? Because this is something we see over and over again. And often if patients are doing ICSI and they're doing IVF, then the doctor might not have even really flagged it too much as being much of a problem. They're doing everything that they're going to do from an IVF point of view. But that's why we're often talking to patients about, from a natural medicine point of view, there's a lot that we feel that we can do in terms of improving those parameters. So that's something, even if you're in those kind of gray areas, we want to know about it because we want to work on it. Could you tell us a little bit about morphology as well?
Yeah, so the morphology range is anything above 4% normal is considered okay, and that sounds...
Which means 96% not normal.
96% abnormal.
Which is pretty incredible. That's not...
incredible. It is also, though, in a very, very good sample, we would see 85 or 90% of sperm still abnormal, and that is part of the reason why there are so many sperm in healthy individuals. Males will produce 1,000 sperm per heartbeat. And of course, we're looking at millions and millions of sperm per ejaculate in a healthy sample, up to 100 or 150 million even. So we are able to deal with a high portion of them being abnormal. But when the morphology gets at that 4% level, then there's a strong indication that there are other factors affecting the health of the sperm, and it makes it much less likely that you'll conceive naturally if you have 4% abnormal sperm as opposed to about 8%. 8%, I think, is a pretty reasonable aim. And we do know that there are a lot of examples of natural conception with a high portion of abnormal sperm with morphology, but obviously the more that you can improve that, the better the outcomes.
Yeah, absolutely. And so in terms of COVID, what are you seeing clinically, and can you tell us a little bit about kind of like the research around what's happening with male fertility and sperm and around COVID infection?
Yeah, it's a huge topic at the moment, of course, because
Yeah.
we are all getting COVID. I had it 2 weeks ago,
Yeah.
and the implications are not just for our physical and respiratory health, but actually also for our reproductive health. The good
Yeah.
news for females is that the research has shown that there isn't a significant influence on female conception rates, despite the menstrual cycle disruption that certainly
Yeah.
the thing.
Yeah. Yeah.
Uh, but with males, it's actually a very different story, and that's because the testes are a highly vascularized and fragile environment that are really, really sensitive to thrombosis, and of course, that's a key feature of COVID that makes it different to usual respiratory infections. This systemic thrombotic nature, so it's a clotting that can damage all of the tiny blood vessels in the testes that are essential for feeding those germ cells that produce the sperm. And also inflammation has significant influences on those germ cells too. So we know from post-mortem examinations of individuals who have passed with COVID that they have significant damage and depletion in numbers of those specific cells that produce sperm, or a better way to put it would be there's a lot of inflammation and damage to the testes.
Right.
From those who have survived but had COVID, that men tend to have lower testosterone levels and lower sperm counts in the months following COVID.
Okay. And how long have they seen that being implicated? Like,
so
how significantly?
Yes.
Yeah.
So just about everybody, no matter what their level of fertility or their level of COVID infection, there is a very strong likelihood that for 3 months following the infection, they will have compromised sperm count and quality. Right. And so it's not too cautious to suggest not going ahead with an IVF cycle within 3 months after a COVID infection, which is really challenging, I know, for a lot of our patients with short time frames, but it's just unlikely. Sadly, it's just unlikely that you'll get the same results within that 3 months. For some individuals, we are seeing what I am calling long COVID of the testes, meaning that there is potentially long-term and question mark even over whether or not there's a permanent damage to the testicular function and therefore the sperm quality. I've got one or two patients for whom it seems very, very clear that has been the case. Really, really gratefully, vaccination has been shown to be protective against that. So it significantly reduces the incidence of testicular inflammation. There is still a risk, but the risk of the very long and very significant compromise in male fertility is much reduced, gratefully, with vaccination.
Yeah, that's great. And I was recently at the Fertility Society of Australia conference, and they talked a lot about pregnancy as well, and how if vaccinated, you're really reducing those risks, which are huge. Infection and pregnancy. So that was really interesting to really kind of get those facts and figures. I've done quite a lot of research on that now. So you'd think either way you'd be wanting to, be vaccinated and boosted. Yes. Okay, so what can we do? So what can we do about if you in those acute stages, and you're undergoing fertility treatment, or you're just trying to conceive and you really want to do everything and that you've done with COVID? Like, what would you suggest?
Yeah, well, I think probably the first thing to say is that, like all other indicators of susceptibility to COVID severity, you are much better prepared to navigate a COVID infection without severe complications for testicular health if you are otherwise well. So it's a really good time if you've got health issues overhanging your head, if you've got blood pressure issues or blood sugar issues or weight issues, now is a really good time to focus on optimizing your health. Yeah, exactly. We certainly are not going to claim at all that we can treat COVID or prevent COVID with any natural supplements or dietary interventions, but we absolutely know, of course, that the better your diet and the less nutritional deficiencies that you have, the more capable your immune system is at managing the assault of an infection. So ensuring, I would say, that your pathology is up to date, that you've seen your GP and had all of those relevant pathology markers. And I would say on top of that, that you've seen your integrative practitioner, whether that is a functional medicine GP or a naturopath, who is really capable at reading pathology, interpreting pathology, and ensuring that you've got optimal supplement interventions to make sure that your levels are as adequate as they can be. In little things like vitamin D, there's quite a lot of evidence showing that vitamin D status strongly correlates with hospitalisation with COVID.
Yeah, absolutely.
Yeah.
And so more broadly, when people are recovering, are these kind of like similar recommendations you'd make during, I guess, the recovery post-viral phase, as well as around the acute phase?
Yeah, exactly. And we would really look at whether or not there was significant inflammation. If we get to see patients during the acute phase, we're certainly looking at whether or not there's significant inflammation and whether or not that is potentially influencing that microcirculation in that testicular environment and working on how we can mitigate that as much as possible.
Yeah, sure.
Yeah.
Sure. So what would be your top tips in terms of people out there who are just sort of starting to, maybe listening today and just thinking about either their partner or potentially their donor or themselves, men out there just like listening and trying to think, well, what are the things that I can do to really what are the big bang, big impact kind of points you in terms of diet, lifestyle, supplementation, everything you do as a naturopath? What are the kind of what are your key takeaways?
Yeah, absolutely.
No, we don't have obviously it's very complex, but
of course. But some basic things, a good whole food diet, of course, really a low sugar diet is an excellent strategy around COVID. Poorly controlled blood glucose levels have absolutely been associated with COVID severity, but also are key contributors to things like blood pressure, which then really do make you vulnerable to the complications of COVID. So eating a good plant-rich whole food diet with good quality proteins and good fats, but minimal sugar, getting your carbs from complex carbs instead of white carbs and sugar is certainly preferable. Keeping up your exercise routine, keeping your cardiovascular fitness as optimal as possible, again, so that your circulatory health is as in good shape as it can be. And then if again, I'll reiterate, of course, we're not saying we're going to treat or prevent COVID with supplements, but generally it really doesn't hurt, of course, to take some vitamin C from an immune perspective. We know that vitamin C is otherwise a chief antioxidant in the seminal fluid, so it's a key nutrient for sperm health anyway. Very likely, I don't know what it's like in Sydney, Amy, compared to Melbourne where I am, but very likely, of course, at this time of year, being the end of winter, that most of us are low in vitamin D. So ideally getting that tested and supplementing the right dose. And of course, zinc is well regarded as both a fundamental immune and male fertility nutrient. So, just taking a basic zinc supplement. Clinically, we would test zinc, but outside of that, certainly taking a basic zinc supplement is not going to hurt. So some vitamin D, vitamin C, and zinc would only be helpful from a supplement perspective.
Okay. Yeah, great. Well, fantastic. I mean, I feel like, you've given us some really good kind of takeaways in terms of lifestyle as well as diet, and also, some key kind of supplements that are really kind of important in terms of immune health. And thank you today for explaining about how COVID, like really going into how COVID can affect sperm health, because I think a lot of people aren't really kind of clear on if it does and how it does. So, that was really fascinating and interesting. I think we're running out of time, so we might finish up. Is there any other last words of advice you'd like to impart on our listeners today?
Probably, the basics. Wear a mask, get vaccinated, stay fit and healthy, and take care of yourself.
Yeah, thank you.
And be patient. If you do get a COVID infection, don't rush into your next treatment if you have the time up your sleeve, because unfortunately the chance of success is much less in those following 3 months.
Yeah. Okay. That's great advice. Thanks so much today, Rhiannon. It's been really valuable talking to you today and really interesting and super informative. For those of you who are watching the recording, or if you're looking at the live, you can catch all of our Making It on Mondays, all our different topics at the Acupuncture, Fertility and IVF Support Group Facebook, which is a private, free support group where we do these weekly Making It on Mondays. You can watch the recordings there. You can ask us questions, and we'd love to see you over there. Thanks so much today, Rhiannon. It's been such a pleasure having you, and super interesting. So thanks so much for your time and expertise.
Thanks so much, Amy. Bye, everyone.
See you. Bye.